Hello, ladies and gentlemen. My name is Dr. Kevin Trango. I'm a specialist in occupational environmental medicine. I'm also board certified in internal medicine and preventive medicine. Today we're going to talk about a disease called reflex sympathetic dystrophy. In fact, the title of the topic is the ABCs and other sort of alphabet syndromes, because we're not only talking about RSD, but its new name, which is CRPS. We're going to talk about the disease, its classification, its treatment, and its progression. There are two agencies that actually define what this disease is. One is the IASP, as I said, a lot of initials, International Association for the Study of Pain, and is now called Complex Regional Pain Syndrome. So what you know as RSD is now CRPS. It's a disease that is caused when we have an injury or an insult to the body of some sort, no matter how minor. It could be a scratch, could be a cut, could be surgery, could be a fracture. And it leads to a vicious cycle in the sympathetic nervous system that leads to unending pain and all the consequences of that. We don't know what causes it, but we do know that it starts out with an injury. There's not a nerve that's affected in particular, because if it is, it has a different name. It's a neurological lesion of a different sort. But it's a chronic pain syndrome. As I said, the origin is unclear, but it has to do with the autonomic nervous system, the sympathetic nervous system. It's caused, as I said, by injuries, it's caused by surgery, by fractures, and a variety of other things. Even minor insults can lead to RSD, or what's now called the CRPS. What are the criteria? Simply, the IASP defines 4 criteria. One is you have to have something that happens. That's what we call a noxious event, whether it's a cut or a bruise or a fracture. The second thing is you have to have what in English means pain that's unending and out of proportion to any type of injury. The third is you have to have some changes, some objective changes. In other words, there's difference in skin temperature and skin turgor and the sweating and the actual skin temperature. And lastly, you cannot have another problem that's causing it. In other words, if you cut your nerve, if you have a different kind of problem such as MS, then it's no longer complex regional pain syndrome, RSD. There's typically 3 stages. We start out in the hyperemic, where you have a lot of blood flow. You then become to the point where the blood flow is decreasing, and then you start to develop atrophy. So you go through different stages. It can be at the beginning, painful, tender, swollen, and warm. There can be sweating, discoloration. As time goes on, the pain becomes more pronounced. It becomes localized to a certain area, and it's very abnormal. This is the very beginning of it, where you may have some skin chafing and some redness, but you don't yet have all the major effects you will have later on. As time goes on, you have discoloration, you have swelling, and eventually you'll have even more pronounced changes. In stage 2, for example, after you've had it for weeks or months typically, you'll have a burning pain, and you will have the skin begin to cool off, the hair will begin to fall out, the nails will change, and you'll begin to lose muscle mass. You can present as shiny and dry and scaly skin. The nails become brittle, and you have actually measurable differences in temperature as well as color changes when you take pictures, just as I saw you before. The swelling is measurable, and the pain is discernible. For example, you see one here where you can obviously see the difference in the 2 sides. And here's another example: skin coloration, swelling, redness, warmth, and if you were to measure it, you'll see a temperature difference also. Stage 3 is when it really becomes much more pronounced. And patients I have seen to the point where the muscle not only atrophies, you develop contractures, but gets to the point you actually have amputation of the limb, either by the fact that it's no longer being used and almost withers away, or because the pain is so severe, some people actually opt for amputation. You get stiff joints, weakness, all the things you see here: tremors, decreased muscular strength, etc. This is an example of early stage where you're developing contractures. And then later on, you actually see it's almost like gangrene. It's not, but the skin changes color, it changes texture, and it's very pronounced. On x-rays, you can also see the difference. As one develops changes in the x-ray, in fact, one of the criteria is in the x-rays, looking at bone scans and looking at the x-rays themselves, both of them. You'll have areas, because you're not using the extremity, where the bone becomes completely washed out, or what we call osteopenia, which is one step before osteoporosis. This is a typical example where you can see whitening of the bone. Later on, you do a bone scan, and you'll see different changes in the bone scan, sometimes increased flow, sometimes decreased flow, depending what stage you're at. These are objective criteria. If you're looking at, as the AMA defines it, there are 11 criteria that one look at. To summarize, as the AMA guides have done in the 5th edition, there are 11 criteria they use to define what RSD, now known as complex regional pain syndrome, is. Cool skin, edema, mottled or cyanotic skin, meaning the temperature is different, there's swelling, and it's no longer the same color as the other skin. These are called vasomotor changes. Pseudomotor is the amount of sweat. It's either overly dry, as you saw on the skin that almost looked like moss, or it's overly moist, and there's a lot of sweating compared to one side compared to the other. Trophic changes that we looked at before, it's decreased range of motion because you no longer have the movement in your joints. The nails become curved like Howard Hughes. You develop changes in the hair, it falls out. There's a real difference from side to side. You can measure the skin atrophy by measuring the circumference, and the elasticity is different. It'll tent on one side and not on the other side. And lastly, the radiographic changes. On x-rays, you have osteoporosis, or at least decreased bone. And on the bone scan, you end up having changes of either too much bone or too little. Anyhow, this is RSD, now known as CRPS, and these are all the ABCs of that disease. I thank you.